All right, so we're joined all the way from Houston, Texas, by my friend Ivy Nwogu-Williams, pharmacy specialist with Ochsner Health. We thank you so much for taking some time for us today. This is our health science career cluster in our college career readiness class here at Velma Jackson High School. I've got a room full here with me, and we're recording this for all of our friends in Madison County schools: Madison Central, Rosa Scott, Ridgeland High School, Germantown High School, the Academic Options Center, and my good friend Mary Slaughter in the Health Science Core Career group at the Madison County Career and Technical Center and our YouTube channel. So thank you so much for taking some time for us today to talk about this incredible field in health science.
Of course, I'm excited.
Now, just give us we obviously want to talk about all the things that pharmacists do and why they're so important. But just give us a little background. You went to UT Austin
Yes.
uh, and for your undergrad, and then went to the unbelievable HBCU at the world-renowned pharmacy school in Xavier down in New Orleans. So just take us through that process. I think it's really cool to have a PWI HBCU combo. It just adds so much to an education because both of them have so many great things to offer.
Yes. So I did 4 years at the University of Texas at Austin, got my public health degree there, enjoyed my time there for the 4 years. And then I actually took a year off, a gap year to figure out my life because I didn't know exactly what I wanted to do. So during that time, my uncle has a pharmacy, an independent pharmacy here in Houston, Texas. So I was
Oh,
using that time to work for him as a cashier back, like, behind his pharmacy. So
yeah.
I was able to see firsthand what pharmacists do because I really didn't know in undergrad. I was trying to go to, I think I wanted to do medical school, like, be a pediatrician. And, life didn't turn out that that way. So shout out my uncle for the year, a gap year. Loved everything he did, the community that he served, which was really like the underserved community within the North Houston area. So helped pushed me to, pursue pharmacy. And he actually was a Xavier grad too. So that's how I got connected with Xavier. I didn't know too much about Xavier at the time because I'm like a really Houston, Texas girl. To leave Texas was a lot for me, but he pushed Xavier HBCU, like you mentioned, as well as just good curriculum, academics. Very high on the scale as far as healthcare and medical
Oh, yeah.
licenses. So, the whole nine as far as the school. And so I decided to apply to Xavier, which is the HBCUs, like you said. Amazing school, had a great time there. As far as just like learning more about the HBCU culture. Now, one thing that's a little bit different compared to other HBCUs is that Xavier is based, it's like a Catholic system. So it's a private school compared to other public HBCU schools, which was an amazing experience to have. One thing I loved about Xavier is that they really focus on their professionalism, academics. So I am who I am today because of Xavier. Did 4 years there, did my academics there, and then moved along to North Carolina, where I did 2 years of residency for my pharmacy degree to then pursue my career now with Ochsner, digital medicine.
That's awesome. And you did mention about Xavier being Catholic. It's the only Catholic HBCU in America,
Right.
which is
Yeah.
a really interesting distinction.
Right.
And their record of healthcare professionals is so long you can't even count it.
Right.
But you mentioned something interesting there, and I'm glad you did because we had an alum who's a physical therapist, and along a similar line, he got his undergrad from Jackson State in public health. And then he spent a gap year. See, I think a gap year is very misunderstood because people think you're just bumming around. Well, you used that gap
Right.
year like he did. He used that gap year to learn his field. He spent a year as a PT tech here at Capital Ortho in Jackson, learned how he would work with patients as a physical therapist, learn the business, learn the lingo, and then PT school was a breeze for him.
Right.
So, if pharmacy is kind of the same way. Once you get that degree, you work in the field, work as a pharmacy tech. I mean, there's a big need for pharmacy techs anyway. We'll talk about that in a
Correct.
second. But you can work as a pharmacy tech, work one on one with customers, and then that makes pharmacy school that much easier because you've already spent some time getting familiar with the drug. So it really
Right.
is such for any health related field, it's such a good idea to make use of that time if you're still trying to weigh your options.
Right. Correct. I did definitely agree. It was a good experience. I spent a year there. I knew I didn't want to do anything like bedside, like nursing or anything. I wanted to get more patient interaction, direct contact. So it was a good experience.
Yeah, and that's a great segue to what I want to talk about next. Because when we talk about health science, and it's such a popular field as it should be, because we always need great healthcare professionals of
Correct.
all sort. But you just hear people say, "I want to be a doctor, I want to be a nurse." but there are literally so many other things that touch patient
So
care.
many.
A couple years ago, I had an emergency medical situation, and I was in the hospital. And yes, I dealt with doctors. Yes, I dealt with nurses, but I dealt with so many other people that were coming through that weren't necessarily there in an emergency situation, but they had a big hand in my overall care, my overall stay. I had a nutritionist come in and ask
Hmm.
about what things could go in my body. A pharmacist had to mix my IV bag before it came up to me to make sure the right drugs were in it, to make sure I didn't have any allergies. And then you had a phlebotomist come take my blood. You had a
Right.
CNA come do some things. I had some techs, hooking up the machines and all that stuff. So it really is so many areas that don't necessarily meet the doctor or nurse thing that are so needed and so vital and also pay great. And I always say the people ask what a pharmacist is, they're the medicine expert. So all these chemicals that are going to someone's body, they've got to be the expert on that.
Correct. 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 I definitely agree. When I want to, and it also depends on the quality of life you're trying to live. A lot of people don't want to spend years and years and years in school that the medical doctors do. And there's other avenues that you can spend your time in, do 2 to 3 years or 4 years in school and still have a good, well-paying job, stable life, as well as get all the information you need to help your patients if you decide to go which way you go.
Yeah, and then at the end of the day, you still have a huge hand in helping people. A
Right.
pharmacist may not be the one in there hooking up the the IED and doing the shock or the one doing
Yeah,
the
the
surgery, but
CPR.
they
Yeah.
still have they have a huge hand in that because the pharmacists are vital to if
Right.
a doctor needs something in a hurry, the pharmacist is the one getting it all
Right
together to make sure
there.
the right
Pulling the
dosage has got to
medications.
be. Yeah.
Mm-hmm.
So,
Yep.
uh, pharmacy is such an important field in inpatient care, but you're probably not going to have the stress of having to cut somebody open and
Right.
stop the bleeding.
Right. Or
But
sewing them back together.
yeah, and it is, and with all these technological advances, it is not going anywhere. Now, you also mentioned there, and I like this too because you talked about it all depends on what you want to do. It all depends on your family, what type of hours you want to work. We have a lot of kids that say, the 4 year college it really isn't my jam, but you can get an associate's, and there are great careers in patient care that work with a pharmacist, and we desperately need people to get into these jobs.
Right, right, right. And one of the desperate ones we definitely need, and we will continue to need, is pharmacy technicians. That's the one that you do not have to get a 4 year degree with. Most of the time, you just have to do a certification. So do a little bit of shadowing, do some hours along with the pharmacist, get certified. Doesn't really involve too much schooling as far as like 4 years or 5 years, and still get a good, well-paying job. And the nice thing about pharmacy techs is that now it's not only the retail pharmacy, it's not only the Walmart, Walmart, CVS. You can work in the hospital, you can work in clinics. They even have different names for pharmacy techs now. Like in my hospital system, some of our techs are called medication access specialists. So they do something totally different than what a retail pharmacist does. And what they do is they contact the patient to make sure they have access to their medications, talking to insurance companies and making sure, hey, how do I get this patient's medication to them in an accessible way? So definitely need pharmacy techs. That's one of the big things that we love. Our system, our whole pharmacy system cannot work without pharmacy techs. Me as a pharmacist, I cannot survive without a pharmacy tech. It's crucial.
Yeah, and I tell you, during COVID, I went and got the shot, and I had to wait like 45 minutes. And
Right.
the poor girl working there, she goes, "Yeah, I'm sorry about your wait. We have 5 posted positions for pharmacy techs right now."
Correct.
And it really came to light during COVID about how needed we are. And I know we have a great pharmacy tech program that's going to see this later at our our health science career bunch over there at MCTC Career Center. But it's also important to understand that pharmacy is kind of like nursing, and the fact that if you don't really like the setting you're in, if you're in pharmacy, you can move to a different setting
Definitely.
because
Yes.
obviously retail pharmacy is always going to be a big need. They're working, they're getting the prescriptions coming from the doctors. They're working with the customers one on one. But if you get burned out with that, you can move to the hospital setting. There's always a need for the pharmacist to be, like we mentioned, mixing the IV bags.
Right.
Um, or in nursing homes when an elderly person's got to be on a certain medicine every day. There's got
Right.
to be a pharmacy person to oversee that to make sure it's all done correctly.
Right. And so actually so Ochsner has a big pharmacy department in general, but the department is split into many, many departments. So to get a little bit into what I actually do, it's not the typical pharmacy role within the Ivy Pharmacy. So my I work for Ochsner Digital Medicine. So what I do is I do a lot of chronic disease management. So I manage patients who have hypertension, diabetes, cholesterol, heart failure, chronic kidney disease. And what I do is that I work hand in hand with the primary care physician, the cardiologist, the nephrologist, the kidney doctor, whatever it could be, to help change their medications to make sure that they're meeting their goals to help prevent long-term complications such as heart attack or stroke. So that's one niche that I knew I wanted to do. I didn't really want to be in retail pharmacy, but I knew I wanted to be a little bit more direct as far as helping patients, a little bit more, yeah, direct with helping patients. So that's what I do. So yeah, you're right. There's different avenues. You have your retail pharmacy. What I do is clinical based. So you have your clinical pharmacists. You know, you have pharmacists now on the floors with like critical care doctors. You have on the cardiology floor now. You have pharmacists who help with the pharmaceuticals. So like helping build like all these Pfizer drugs and Eli Lilly drugs, like some of the drugs people know, like Ozempic and, Monjaro. Pharmacists play a big role in that as well. So we definitely have different avenues similar to nursing as well.
Yeah, and similar to nursing is also it has a variety of hours. There's always a
Right,
pharmacist at the hospital. So if you're an
right,
overnight person and you want that overnight shift, they've got to have a
it's
pharmacist
an
in the
option.
building all the time.
Right. And it's more money. So if you ever think
Yeah.
about being an overnight pharmacist, just know it is more money because it's well needed.
Yeah. Now, if somebody was interested in pharmacy, whether it be to go the full pharmacy school or to work as a technician or just a pharmacy assistant, any of that. What type of courses would they need to focus on? Because it is very, I mean, obviously biology is important. You got to know how the
Yeah.
body works, but this is very, very chemistry based. So all of our chemistry people, this is a great field to get into. And if you want to get into it, you've got to know your chemistry.
Right, right, right. So most of the time you have about as far as schooling, you have two avenues. So when you get into your schooling degree, whether it's a 4-year university or a junior college, so a 2-year university, you can do 2 years of schooling to get your prereqs and don't require a 4-year degree to go to pharmacy school. Or you can take a little bit more time and do your 4 years, get your degree, and then apply to pharmacy school. So that's the nice thing about pharmacy school. You are not required to have a degree prior to going into pharmacy or applying for pharmacy school now. So most of the time, the prereqs are the typical prereqs: biology, chemistry, organic chemistry, history, algebra in some cases, or calculus in some cases. The typical prereqs you'll do for any other healthcare um, um, career that you want to do, such as being let's say, being a medical doctor, or you're trying to go into nursing school. Most of the time, those are all similar prereqs with a little bit of different nuances here and there. But typical prereqs that you get from any junior college or 4-year degree, whatever you prefer, and whatever's cost efficient, because that's the biggest thing with schooling is cost. And do your 2 years, apply to pharmacy school, or you decide to do a 4-year degree like me and do your 4 years, graduate, and then go to pharmacy school, whatever you prefer.
Yeah, and a lot of these colleges have partnerships with the med schools.
Right.
We've had several alums that have gone to Alcorn State, great HBCU here in Mississippi, and they've done the first 2 years at Alcorn and then finished up the last 3 years at UMC here in Jackson. Or some of them have gone to Oxford at Ole Miss, and the whole time they are still in that Alcorn program. So pharmacy really has a lot of partnerships and a lot of interesting ways you can go. And they were
Right.
telling me the different options, and I was like, wow. I didn't
Yes.
know that. So that really is something to look into about what fits you best.
Right.
What would be the best academic setting for you? What would be the best financial situation for you? So, really, really a lot of ways to get into it.
Yeah, and Xavier actually plugged my school. Xavier has a program where it's called the CAP program, where if you do 2 years undergrad at Xavier, you meet a certain GPA requirement. Upon doing your 2 years, you get automatic acceptance into the Xavier Pharmacy
Uh,
School. So if that's something like students are, involved in or interested in, that's something they can do. And I'm sure that other schools have that opportunity too. Don't know because I can't speak on them, but for sure for Xavier, do your 2 years, make your GPA requirement, you get automatically accepted, and you start your third year as a first year pharmacy school student. So that's really cool.
That's awesome. Well,
Yeah,
before I get to their questions, one thing I did want to talk about, and I think this is important for anything health related, is we need as much diversity in this field as possible.
of course,
And
agreed.
and it's not just a matter of giving people opportunity. It's a matter of public health. Because if there's only one type of person making health decisions and involved in patient care, I don't care what anybody says, things are going to fall through the cracks. It's not that these people are evil or that they're racist or what. It's they don't understand a lot of cultural things. They don't understand
Right.
a lot of health issues within a community or even within a gender. So it is so important for these kids to see, like, just because you haven't seen it in your community doesn't mean you can't
It's
do
not
it.
fair.
And just
Right.
because you're the first at something doesn't mean you can't be the best at something. So, as somebody that's right there in the middle of all this healthcare and sees health issues all over the world, why should every kind of kid, no matter what their background is or what their gender is, really consider getting into this?
That's a very good question. And growing up for me, diversity was very important. It was nice seeing people of my color in the areas that I were going because it gave me confidence. Sometimes when you go to PWI schools like I did, you don't see, enough people with your skin color or the type of gender, more males than females, more black people than white people. So it just depends. And I feel like that gives you a certain encouragement. And also, sometimes there's cultural differences that some people just would not understand. And if you have a very diverse team, you can bridge that gap for that patient and they can understand, hey, my doctor's saying this. I kind of don't agree with it. How do you feel about it? And I'll tell them my clinical expertise and they can, have that camaraderie with that patient and that rewarding experience where they'll be like, hey, you know what? I do trust you because obviously you look like me or you're a female or whatever the case may be. And now they have that trusting relationship to for you to then help them trust their provider because there's that gap in that care. So it's definitely very important. I think diversity will always be important in every single avenue that we go, and I will always continue to promote it as well too.
Yeah, and on top of that, for our kids moan and groan when they have to learn another language,
Right.
anybody bilingual, you are needed in healthcare. If you can learn to sign
Yes.
if
Yes.
you can learn sign language, which my sisters have done, which it just blows my mind, they're 100% hearing people, but they have learned sign language and they can communicate with hearing impaired, and it is just incredible. Being able to learn any type of extra communication, I'm telling you, makes you very marketable in the healthcare field.
Yes.
I don't think that is pushed enough.
Yeah, I wish I took my Spanish classes seriously because I had to take 3 years of Spanish when I was in high school. And I think at that, like looking back at it now, I wish I took it more seriously. At the time, I was just doing it to get the grade so I can move on to the next. But yes, everything, different languages, holding different languages. Number one, it's very marketable. It gives you a higher salary, of course. And plus, you're able to be that go to person when that person feels uncomfortable and cannot speak the language that is the normal language for the city. The nice thing I would say is that most hospital systems have a great interpreter language contact or call center where you can get in contact, so it doesn't mean that you can't talk to the patient at all, but that's over the phone. If you're in person, you kind of need that person at the reception who can handle all things related to the area or underserved population that you're living in. So yeah, if you guys are learning Spanish, French, whatever it is, take it seriously. It's a big thing.
Yeah, and I always laugh, because my dad's actually a doctor. He's getting ready. He's towards the end of his career now, but he's had to learn pretty good Spanish. And he said, "Look, in an emergency situation, I didn't have time to look for an interpreter. I've got to get answers."
Right,
So
right.
if it is amazing how important that could be. Well, I do have some great questions from the students. I'll get
Yeah.
to as many of these as I can. This first one, she actually had to leave, but left me some great questions. This is
Okay.
Landria Wilder. She's a senior, wants to be a nurse.
Okay.
Our student council president here at Velma Jackson. But she asked, "How do you determine the correct dosage in order? How do you determine the correct dosage for a patient when you get the diagnosis?"
Oh, that's a very good question, and it's very complex. So, most of the time, if you have a healthy patient, there's already a recommended dosing that came with the prescription that has been studied in clinical trials to know that that medication is safe in that patient. However, you also have to take into account certain risk factors for that patient. Do they have kidney disease? Do they have liver disease? Because all that depends on if you're adjusting their medication, whether you're going a little bit higher or you're getting a little bit lower. So I like to tell my patients that just because your friend is on one dose doesn't mean that that dose is right for you. So it just depends on the patient. Depends on their risk factors. How old they are also depends. Age, whether they're like young, pediatric, or elderly, also depends. So, it's a lot of things that we have to assess for the patient to determine the right dose. But in general, if it's an overall healthy patient, they have recommended doses based on clinical trials that I've studied in patients to show that this is a safe dose for the patient.
That's awesome.
Yeah.
Now, she also asked, how do you remember all the pros and cons of certain medications if a patient tells you they want to save money buying over-the-counter medication?
Oh, that's a good question. If they want to save money buying over-the-counter medications, but you have to weigh the pros and costs, practice, clinical practice. So what that means is that clinical expertise, once you've been in the game for 2, 10, 15 years, it comes like clockwork. So the first year, maybe a little learning curve. You may have to take some time to go back to your notes, look at, okay, why you would try one medication for versus another, why you would be on ibuprofen for pain versus Tylenol for pain. But every medication has their pros and cons. And once you start, um, once you start counseling patients over and over and over again on those medications, it kind of sticks. It kind of is like clockwork. It's like knowing your phone number off the top of your head. That's how I see it. So, like when my family asks me, okay, why should I take ibuprofen or Advil or can I take Tylenol? I'm asking them a series of questions to know, okay, well, do you have liver disease? Do you have kidney disease? Do you have a history of high blood pressure? Okay, well, this one is best for you. Or if you have cold medicines, a lot of the cold medicines affect your blood pressure. Well, I recommend this. If you have high blood pressure, if you don't have high blood pressure, I recommend this. So just depend. It's really clinical expertise. The more you are in practice, learning and learning about a lot of things, it comes like clockwork.
Well, and she has one more question, and that's a great segue to this question because she
Okay.
asked, how hard is it to remember all of the types of drugs and the way they interact with the body?
Oh, it is. I will say it's kind of hard, but what I will say is you never stop learning. So, like, you have to find your way of learning things, whether it's some people keep a pocketbook next to them and, just write things that they learn every day. You never stop learning. So, I want to say it's hard, but it gets easier. It gets easier as you go on year by year and you get those years behind on your belt and be like, hey, I've been in the game for 5 years, 10 years. I've been in the game for now 3 years with Ochsner, which is my first big girl job. And I can tell you now that I'm not the same person coming in 2022 compared to 2025 because I've learned so much. But it gets easier. I feel way more confident in myself, which allows me to learn more information. And so I think the easiest thing is going to continuing education classes. We are required in order to maintain our license by continuing our learning experiences. So we have to attend classes, we have to attend seminars to learn what's new, what's changed. And that also helps, keep that information fresh in our minds every year. So that also helps get us, in check and make sure we're doing everything we can to provide the best care to our patients.
Love it. Well, I got this one. This is Cortez Maxwell. He's in 11th grade. And he asked, what are the most common challenges you face on the job?
Oh, that's a good question. Common challenges. I think the common challenges I face on a job is breaking stigma. So, breaking barriers that people hear on the internet and hear on the news and hear all on Google. Google doctor is not always your best friend. And I think it's like things like that, having to break it down and be like, yeah, you read this on Google, but let me give you some more information on what actually is the truth versus what is like, fiction. So I think it's just breaking down what people see on internet because the internet can be very, very scary, which can also like, deter a patient from either taking their medications or not. So I think that's the biggest challenge I have is just making sure people get the right information and not listening to the wrong information.
Awesome. Well, I got time for one more. This is Erin Gaines. She's in ninth grade. She asked, what do you think are the biggest health issues facing our community today?
Oh, good. That's a very good question. And that's right on my field of what I do. Chronic diseases, I feel like is the biggest issue that we deal with today as far as health issues. That's diabetes, hypertension, heart disease, kidney disease, because all those are chronic conditions, meaning that patients can live life with the diseases. However, heart disease is one of the number one like causes of death in America, and that's because of obesity, so of hypertension. So if we can help manage all of these chronic diseases to help our patients live a longer life, that's what I feel like it's the most beneficial, and that's what I do, and that's what I want to know that my patient's going to be here 10 years from now and be like, hey Ivy, you helped me out with my diabetes and now I'm doing good, and I don't want to hear any other stories about like you passed away or anything like that, because these diseases are the number one cause of death in Americans, and we just want to make sure we want to reduce that number as much as possible.
Oh, big time.
Yeah.
We're almost out of time, and we thank you so much for taking some time for us. But a couple things before we go. First of all, I'm far from a health expert, but I think it's important to say, as these young people start moving on through whatever field they want to do, is never ignore symptoms. A
Right.
lot of so many health professionals have done time in research, done time in school to advance medicine. So no matter what your symptoms may be, go see a professional about it. It may be nothing, or it may be life-threatening. I mentioned my hospital stay. I ignored symptoms for a couple of days, and it almost cost me my life because I did not take the symptoms seriously. Luckily, I finally couldn't take the pain anymore and went in, and they say and that I was fine. But how important is it if you're having symptoms to pay attention to that and tell a medical professional?
Very, very important. I am here for you calling your doctor, whether it's the overnight doctor, whether it's urgent care, whether it's the emergency room, because these symptoms have similar effects. The main symptom that I want people not to ignore is chest pain. Chest pain can be so many different symptoms. Headaches can be so different symptoms if you ignore them. So it's very, very, very important not to ignore your symptoms. Nothing hurts by getting checked out and just getting your labs done or getting physically assessed by a healthcare professional to make sure that you're fine. In this world, we have, access to medications and access to healthcare can be hard, but if you have that access, utilize it while we're working on other ways to get access to to patients who may have limited access. But yeah, definitely recommend getting checked out no matter what. It can be the smallest thing. The smallest thing can lead to the biggest thing. You just never know.
Awesome. Now, the last thing before we go is obviously we talked about so many parts of a healthcare system that are needed for patient care. So whether these kids want to be doctors, nurses, pharmacists, therapists, nutritionists, dietitians, whatever, or the more and more need for engineers in medicine, why should they really consider getting into the health field, no matter what their skill set or their desires might be?
Because we need the help. We need the help. Healthcare is not going anywhere anytime soon. And if you really have if you have a desire or a passion for helping people, healthcare I would say is one of the best avenues to go because you can really see the transformation in patients once they're sick to how they feel. And I don't want anybody to get discouraged and say like, oh, I have to be a doctor to help patients. No, you can be a medical assistant. You can be a respiratory therapist. You can be a physical therapist. You can be the list goes on and on. And all of these ways are helping patients little by little. When I went into pharmacy school as a P1, I didn't even know how pharmacists can be so integral into helping patients until like my second year. And from
Awesome.
then on, I knew like, oh, okay, this is not just typical, retail pharmacy. I can do so much more in this avenue. So, yeah, if you really have a passion for helping people, healthcare is definitely one of the avenues that you can go around. And it can start from the smallest level all the way to the highest level. And that's the benefits of that.
Love it. Well, again, we thank you so much for taking some time for us. I know you got to get back to work. But before we go, give me a hook 'em.
Hook 'em.
All right. Ivy Wogu, all the way from Houston, Texas. Thank you so much for joining us today.
Thank you guys so much. It was a pleasure.
See ya.